to visit, to breathe. Now is not the time to give up. We are stronger than this virus. When it's your turn, roll up your sleeve and stick it to COVID.
What I miss is being out there, coming through the gate and getting ready to play. I miss the noise that Rider fans bring. If I was talking to Rider fans, I would say, get your shot, be ready, because we're going to have a football season and we need you in the stadium.
If you ever had to look a child in the eye that's relying on you to protect them, would you say, yes, I will protect you? And that's essentially it. I will get the vaccine, I will protect you because you can't protect yourself. Because I will do anything at all costs to protect my daughter.
Good afternoon. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe and Dr. Shahab. As well, joining us on the line is the CEO of the Saskatchewan Health Authority, Scott Livingstone. Premier Moe will have opening remarks and Dr. Shahab will have a presentation, followed by time for questions.
Good afternoon, everyone, and thank you for joining us today. Saskatchewan is today in a very good place. As we get ready to remove all of the public health restrictions and public health orders this Sunday, July the 11th, our vaccination numbers do continue to increase and our COVID case numbers continue to decrease. Today, our 7-day average is 31. That's down nearly 90% from the third wave peak that we experienced of about 287. Which was less than 3 months ago in mid-April. And that is due to the fact that so many Saskatchewan people have taken the time to go out and receive their vaccinations. And also due to the fact that vaccines are proving to be highly effective at preventing COVID-19. In our province, nearly 1.25 million vaccine shots have now been administered. 71% of all eligible residents have now received their first shot, and 50%, about half of all of those residents that are eligible, have received their second shot and are now considered fully vaccinated. Everyone over the age of 12 is now eligible to receive both their first and their second shots, and we do have an ample supply of vaccines in the province. And vaccines are available, as we know, at Saskatchewan Health Authority clinics, at our pharmacies, in communities across the province, and in literally every part of Saskatchewan. So there's absolutely no reason for anyone to not consider going out and getting vaccinated. In a couple of minutes, Dr. Shahab is going to present some pretty clear data showing just how effective these vaccines are in Saskatchewan. The difference between being vaccinated and being unvaccinated is truly quite stark. In June, we had about 2,000 positive COVID cases, just over 2,000. Over 80% of those cases were people that were unvaccinated. Fewer than 2% of those cases were people that were fully vaccinated. Under 5% of the hospitalizations also are people that were fully vaccinated. There were no ICU admissions and no deaths of anyone that was fully vaccinated plus 2 weeks. 0 ICU cases, 0 deaths among fully vaccinated people in June in Saskatchewan. The evidence that vaccines are working really couldn't be much more stark than that. It's even more remarkable when you consider that most of the fully vaccinated people in June were our elderly residents. And that's the group that has been traditionally most vulnerable to severe outcomes from COVID-19. Today, that is no longer the case. If you are vaccinated, age is no longer the largest factor in determining your risk from COVID. Whether or not you're vaccinated is. If you're fully vaccinated, you are very, very well protected. If you are not vaccinated, you're at risk, and it is an unnecessary risk, I would most certainly say. So take the time, book your appointment, visit a drive-through or a walk-through clinic in your community or one near you, and please go out and get vaccinated as soon as you can. On March the 13th, 2020, we implemented the very first COVID-related public health orders in this province. That was the limit on size gatherings. In the days that followed, there was more restrictions that were ordered on schools, on businesses, on places of worship, and even some orders that were ordered on your home. Outside of wartime, I don't think a government has ever asked so much of its citizens. This was very difficult for all of us, but it was very necessary. And it does get us to where we are today. With a significant portion of our population protected by these very safe and effective vaccines, this Sunday, after 485 days of public health orders and restrictions being in place, after 485 days of the government telling you how to live your life, all of those restrictions will end. Now, as you can see, there's no mission accomplished banner that is hanging behind me, and that's because although the restrictions are coming to an end, COVID is not. On July the 12th, we will report a number of COVID cases, and we will have vaccinated, yes, many thousands more people than what we have today. This fight against COVID does need to continue, but it will shift into a new and somewhat different phase. Instead of trying to control the COVID infection rate through government-imposed restrictions and government rules, we can now control COVID through vaccines. And by everyone possible in this province doing their part, taking the time to go out and get vaccinated. So yes, the restrictions in Saskatchewan will end on July the 11th. The provincial state of emergency will end on July the 11th. And there's one more thing that's going to end. Today will be our last regularly scheduled COVID briefing. And of course, if something changes in our situation, we will most certainly keep Saskatchewan residents up to date. I'm sure you'll hear from Dr. Shahab if necessary, or the health minister if necessary, or even myself. But we won't be doing these pre-scheduled COVID briefings each week, and it's my hope that Dr. Shahab may even get a day or two off as we go through the summer. So since this is our last weekly briefing, it seems an appropriate time for me to say thank you. Thank you to everyone in Saskatchewan for all that you have done over the past now approaching 17 months. Everything you've done to protect yourself and to protect those around you. Thank you for staying home and staying apart, more than anyone should really ever be asked to do. And thank you for doing your part by getting vaccinated. Thank you to all the essential workers who weren't able to stay at home throughout the course of the past number of months. The essential workers who we depend on to go to work and to provide the goods and the services and the care that Saskatchewan residents need to get us through what has been a very difficult time. Thank you to our healthcare workers. And Scott is on the phone, Scott Livingston, the CEO of our Saskatchewan Health Authority. Through you, thank you to everyone that is working at the Saskatchewan Health Authority to provide the services that we expect in our healthcare system, our publicly funded healthcare system here in Saskatchewan. But everyone that has gone above and beyond and worked in our testing strategy, our contact tracing strategy, and our vaccination strategy, and continue to do so up until July 11th and thereafter. Thank you to all of our doctors, our nurses, all of the medical professionals across this province, and all of the other support staff that have been working so hard and with an extra degree of caution for the last year plus. The people that care for our patients and keep all of our healthcare facilities in all of our communities running and running very well. It's appreciated. And I especially want to take this opportunity to thank Dr. Shahab, our Saskatchewan doctor. I want to thank you for your wisdom, for your judgment, for your perseverance, your compassion. Most certainly and foremost, though, I want to thank you for your guidance to myself, to this government, and to the broader population of this province. You've put in some very long hours over the course of the past year. I know you've put in some sleepless nights because I knew you knew you had to be able to provide us with the best guidance that you could. You know, a while back we were at this very table and we I talked about how Dr. Shahab could have chosen anywhere to work in the world. Anywhere in the world he could have chosen to practice his profession. Well, everyone in this province now knows just how fortunate we are that you chose to come here. So I want to say thank you to Dr. Shahab for all of his efforts. And I want to say thank you to a man that has become a friend of mine. So with that, for the last time, at a regularly scheduled press conference, I want to turn it over to Saskatchewan's Chief Medical Health Officer, Dr. Shahab.
Thank you, Premier, and thank you for those kind remarks, which I think apply to everyone in Saskatchewan who's been working on the front lines in healthcare and as well as otherwise in the province. I'll begin with some updates, and then I'll go through our monthly update on breakthrough cases. So I'll start with my sympathies and condolences to the families and friends of the 2 Saskatchewan residents who have passed away since our last briefing. These deaths were reported yesterday and come after 6 days, thankfully, of no deaths due to COVID-19 reported in the province. The lifting of the public health order comes at a time of very low case numbers throughout the southern part of the province and continuing vaccination initiatives. With the arrival of summer, it's obviously easier for all of us to be outdoors, and we continue to see the benefit of the wide open spaces we have as we enjoy the summer. The low case numbers, however, may give us a sense of complacency. And I think that's really important that we may find the time to get vaccinated. We have high uptake throughout the province, primarily in the large urban centers, a bit of lower uptake in rural areas and in the far north. A lot of people, even in the urban centers, say they'll get the vaccine, but they're busy with jobs and family and friends and can't find the time. And I think it's important that we all find the time. And I know the Saskatchewan Health Authority is continuing to provide innovative ways of delivering vaccines closer to where people are. So please make sure you know where vaccine clinics are being offered. And there's lots of ways to get vaccinated, but do find the time over the next few days and weeks. The higher our vaccine rates go now over the summer, the better and safer fall we'll have. And I think that's being shown in many other parts of the world. COVID-19 will continue to find those who are not vaccinated. And with vaccinations lagging in young people and certain parts of the province, we will continue to see cases and clusters. For example, of today's 53 reported cases, 22 are in people 19 and under, and 17 in 20 to 39. We have a significant outbreak in the far northeast of the province. And again, part of it is due to lower vaccine rates in some communities, but not all. Many communities in rural areas in the far north do have very high vaccine rates, but some don't. And again, the Saskatchewan Health Authority is working with partners to provide vaccines closer to home, especially when these clusters happen, because vaccinations remain our main path out of the pandemic. As the Premier said, last year when we were entering the pandemic, we could not have predicted that within 12 months we would have safe, effective vaccines, and then by today those vaccines will be widely and easily available to us in Canada and Saskatchewan, and we can see that the pandemic is still raging on in other parts of the world. In fact, many countries who didn't see much COVID activity last year are surging right now and locking down right now. So certainly the pandemic is raging in many parts of the world. Many parts of the world do not have good access to vaccines. It is important that we complete our vaccinations, go as high as we can, and make sure that any vaccines that are available are shared with the rest of the world. And now I'll just maybe move to the slide deck to look at our monthly update on breakthrough cases. So this is for the month of June. We presented earlier on May. So we look at two key indicators, 21 days after the first dose, because some immunity develops after the first dose. But then, of course, 2 weeks after the second dose is when our immunity is the strongest, and then that continues for weeks and months. So we look at both those numbers. If we look at our, let's maybe read it from here. if we look at our new cases in June, we can see that 80% were in people who were unvaccinated or within 3 weeks of their first dose. 17% were, after 3 weeks of their first dose, and only 1.8% in people 2 weeks after the second dose. So again, this is what we were hoping to see, and this is what the data is showing. And of the 355 cases with the first dose, 26% had comorbid conditions, and 36 cases with the second dose, 39% had comorbid conditions. So obviously, if you're older, if you have comorbid conditions, you may be at higher risk because the vaccines may not work as well, but certainly the vaccines seem to be working well for the most part across all age groups. If we look at hospitalizations, again, 102 hospitalizations in June. The vast majority, 64%, in people who are unvaccinated or within 3 weeks of receiving the vaccine. Because within 3 weeks, you don't count that as a person being vaccinated even with the first dose, because your exposure may have happened just before you got vaccinated. 30% of cases in people who were more than 3 weeks out for the first dose, and only 5 cases, 5%, in people who were fully vaccinated. And again, among the cases who were reported in June, of the 31 hospitalized with the first dose, 64% had comorbid conditions, and 48% were older than 70. So as we know, if you have comorbid conditions, if you're older, there may be other reasons in addition to COVID that may require hospital admission. We saw that in last year as well, where the COVID was a complicating factor in people with comorbid conditions, and we will continue to see that. And of the 5 hospitalized in ICU cases with the second dose, 80% had comorbid conditions, and 60% were 70 years and older. And similarly, when we look at ICU admissions, 21 ICU admissions in June. So these are new ICU admissions. 17 or 81% were those who were unvaccinated. Only 4 or 19% were those who were 3 weeks after their first dose, and none 2 weeks after the second dose. I think this is really what the vaccines are designed to do. They may offer 80-90% protection against mild illness, but the studies for all vaccines used in Canada showed high protection against hospitalizations, and that's what we are seeing. And so again, I think it's clear that the vaccines are working, and it's important that those who remain unvaccinated or haven't completed the second dose do find the time to do so. Similarly, when we look at deaths, 15 deaths in June, unfortunately, 6 or 40% in those who are unvaccinated, 9 in those who were 3 weeks post the first dose, and no deaths in those who were 2 weeks or more after completing the second dose. And among the cases reported in June, 40% had not been vaccinated, and 9 or 60% had been vaccinated with the first dose. But most vaccinated individuals with the first dose, which was 67%, were ages 80 and older and had comorbid conditions. So again, while the death had COVID as one cause, and there may have been additional causes, age as well as other comorbid conditions accounting for the death. But in any case, I think it's worth recognizing that 2 doses, once you're 2 weeks after your second dose, that is our best protection right now against COVID, and will be for the foreseeable future with all the variants that are currently circulating in Canada. Now, having said that, we do recognize that cases are still occurring, clusters are still occurring, outbreaks are still occurring. They are rare. They're primarily in unvaccinated populations, with some breakthrough cases in those with 1 dose or second dose, as we described. And it's important to remember that 32% of patients in acute care this month in June were less than 40 years old, so 10 out of 31, and 44% of the ICU hospitalizations in June, so 4 out of 9 patients were less than 40 years old. So this is really something that I want to highlight, that while COVID is milder in people who are younger, the fact that now almost all new infections are due to alpha, gamma, and delta variants. We know that these variants are more transmissible and in some cases more severe. So what we saw last year in unvaccinated people, it is going to be a bit more severe if you remain unvaccinated. And I think we really need to recognize that, because on the one hand, we are reopening, and that's great. It's summer, we have a high vaccine uptake, it's safe to reopen, but the risk remains, and if anything, is higher for people who choose to remain unvaccinated. So again, I think the SHA is doing its part to make vaccines available and convenient, but I think all of us need to find the time and help those who aren't able to find the time to complete their vaccinations, to either start or complete their vaccinations. And as we look at vaccine uptake, we already know that throughout Canada, urban centers have a higher uptake than rural areas. Older, I've always said we need to chase the target set by our seniors. We need to chase that target at every age group. And certainly that's what we see, throughout the province in the large urban centers. Regina has the highest vaccine uptake, followed by Saskatoon across all age groups. But then, we see a bit of a decline overall and in the younger age groups, especially in the rural areas in the south, and lower uptake across all age groups in the far north and north. But again, I have to say that some communities have very high uptake, and the vaccine teams are trying to understand why there's variation, how issues of convenience can be addressed, issues of complacency can be addressed, and if there's any questions that have to be answered, how they can be answered, so that the 15-20% of the population who still is unvaccinated chooses to become vaccinated. Because again, the higher we go in our uptake, first dose and second dose, will mean not just a great summer, but a safe and normal fall as well. So with that, I'll end by saying that obviously there's lots we can do now in step 2. There's much more that we'll be able to do from Sunday onwards. But everyone will take their own time and pace in choosing to, how many friends and family they get together with, what additional activities they engage in. I think we need to respect everyone's pace and reasons for participating or not participating in family events or other activities. Again, in crowded, congested settings where you don't know who you're with, it's sometimes probably going to be a good idea to put a mask on during those times. I think getting tested when you're unwell is going to be critical. Staying home if you are unwell till you've been cleared by public health, till your symptoms are better, is going to be critical. If you are named as a close contact and you're not unvaccinated, you still will have to isolate because our number of contacts are higher. Even if public health hasn't reached you, if you were a close contact, more than 50 minutes face-to-face in an indoor location with someone who tested positive COVID, you should isolate yourself even before public health contacts you, especially if you're unvaccinated. If you're fully vaccinated, you need to monitor your symptoms. And at the first sign of symptoms, although it's unlikely that you will get COVID, but if you even get mild symptoms, you can still transmit. You should isolate and get tested. All these measures will continue, staying home if you're unwell, getting tested, isolating as a case or contact. And these simple measures that should be second nature to us will, even as we reopen, hopefully keep our numbers low, even as we are doing more and more and throughout the summer and also into the fall. And with that, I'll just maybe continue with just some additional points that, after Sunday, we'll continue to see promotion of vaccine clinics, including targeted efforts to reach communities and populations who are under-vaccinated. We'll continue to see people masking and maintaining their distance if they choose to do so, and some businesses may be wide open. Some may ask for people to wear masks or maintain social distancing. I think we need to respect each setting in terms of what they've determined as a safe place at this point for them, their customers and staff, which may change over time. Public health follow-up will continue. And finally, I'll just say that, it's really important to be aware of what the epidemiology is in your part of the province. If for some reason we see a bit of a surge, all these measures become even doubly important for that period of time. If case numbers remain low throughout the province or in different parts of the province where you are, as on the dashboard, you can probably, do more. But, just having that local awareness of case numbers will be important as well for the next little while. Thank you.
Thank you, Premier Moe and Dr. Shahab. we will now take questions, and we'll start in the room. Lynn?
So you've talked a lot about living with COVID even after July 11th. What is the provincial government expecting to see after July 11th and preparing for from a health standpoint? Like, are we still anticipating summer outbreaks, an increase in hospitalizations once everything's gone? Like, what are we expecting?
Dr. Shahab and maybe even Scott speak to the level of what they might be expecting with respect to hospitalizations and outbreaks of that nature. But July 11th, what happens is we'll lift the emergency order, we'll lift the masking order, and all of the public health restrictions and measures that have been in place for quite some time will be lifted. And so people will be able to make the choices that they choose to make with who they see, as Dr. Shahab said, what size of a group gathering they go to, whether or not they use their mask at certain times. I think it's fair to say that over the course of the past year that things like mask use have been, very much normalized, and I think we will see people utilizing masks, at certain times when they feel uncomfortable. For example, post July 11th. I'd said this is by no means the end of COVID. This is the end of the public health restrictions that are in place. COVID will still be here on July the 12th, July the 13th, and on through the summer. However, as we have went through the course of the past year, we've utilized various measures to attempt to control the spread of COVID. In the early days and for the bulk of over the course of the last year, we used public health measures. We reduced the gathering sizes, how large a gathering size could be. We put into place many measures that really reduce the interaction of people in our retail environments, at our worship services, and in our sporting and recreation opportunities in our community. That was all to reduce that interaction, to reduce ultimately the spread of COVID. We put in all of the public health recommendations, not orders, around washing your hands, proper sanitary practices that you might have in your home or even in your place of work, and all of these recommendations that were there. By far and away, the most effective tool that we have encountered over the course of the last now 17 months is vaccines and access to 2 doses of a vaccine. And I think the data that Dr. Shahab had put forward proves to really show the effectiveness, just how effective these vaccines have been. So people will make their own choices post July the 11th, and I encourage them to make those choices and go out and interact to the degree that they're comfortable. Utilize a mask if they feel that does make them more comfortable in whatever environment they may be in. But when you look at COVID moving forward, it is a disease of the unvaccinated. We have about 30%, 29% of the people in Saskatchewan that are not vaccinated. When we look at our June numbers, they're responsible for 80% of our cases. 71%, including to a large degree the more elderly population in Saskatchewan, is vaccinated, and they're responsible for less than 20% of those COVID cases, none of the deaths in June, and none of the ICU admissions. And so vaccines, as Dr. Shahab have said, proved to be extremely effective. And I think as we move forward, there's a number of public health recommendations: washing your hands, using a hand sanitizer, wearing a mask if you're uncomfortable, that will remain, and it would be up to individuals to utilize those. But largely, I think the most effective tool is vaccines. COVID and ultimately the severe consequences or effects of COVID that we are seeing are predominantly in those people that choose not to be vaccinated. So the number one advice that we can give anyone from this point forward: take some time, go out, make your appointment, and get vaccinated. Dr. Shahab?
Yeah, thanks. And, in addition to, while we are going to hopefully see very low case numbers, we will see some clusters like right now in the far northeast. And, those will be managed by the community, leadership, by public health, and there'll be surge in testing, contact tracing, using that opportunity to provide vaccinations. Sometimes with other communicable diseases, when there's an outbreak of measles, mumps, or pertussis, that's when suddenly there's more interest in getting vaccinated, which is great. It's never too late to get vaccinated. So unfortunately, those clusters will continue and they'll be managed. I think as our case numbers decrease, we'll still need to inform what are some of the networks, social networks in which transmission is happening. For example, even in large urban centers, it's likely that there'll be transmission events in younger people who may more likely to be unvaccinated, maybe doing more indoors or outdoors. So that will continue, at lower rates over the summer. Maybe it may become a bit higher over the fall as there are more indoor events happening. And that's why, again, while we see great uptake for second doses, and that obviously is essential. The 71% who've had first doses, we hope that we can, we're at 50% second doses well before the end of July. Hopefully everyone who's had a first dose now will complete the second doses. But, even incremental increases in first doses now and second doses later in July or August now, or even into September, is going to help. It's going to help people who may be going back to school or university. Is going to help people who may be traveling or who may be going to or work in a different setting. It's certainly going to help when we do more socializing indoors in the fall, and it'll minimize those clusters and outbreaks. But those, unfortunately, will happen primarily in groups of people who are under vaccinated or unvaccinated.
Follow up, Lynn?
Yeah, with the Delta variant, and there was a warning in yesterday's press release that they're seeing a significant increase. I think almost 100 more were detected. Does that raise concerns about those potential localized outbreaks, and especially with the one in the north right now? Like, are we seeing Delta connected to that one?
Yeah, so, and again, there's some lag even on the numbers, because we have to remember that even last year in the spring and summer, we have been leaders in Canada in deploying point-of-care testing, and even last year, point-of-care testing was used very effectively, and this year our partners are using point-of-care testing and SHS providing surge support. So initially, obviously, we just know that there are new cases being discovered, and that's essential for case contact management and outbreak control. Then it takes a few days for the samples to come to a lab in Saskatoon, Regina for initial determination if it's a variant of concern. It takes another few days to find out if it's a specific variant of concern or variant of interest. But what we are seeing is exactly what, as you've described, that out of new cases, we are seeing very little of the original strain. We are seeing more of the alpha strain throughout the province, mostly in the south, but also in points north. And we are increasingly seeing Delta strain also side by side in the south, but also in Saskatoon, in some of the far north areas. And in addition, we are not seeing so much of the beta strain. But we are seeing more along the western part of the province, the gamma strain as well. So there's three variants, and some clusters may have two or three, because if people brought COVID in from different parts of the province or other provinces, you may see 2 or 3 strains in the same cluster or outbreak. But over time, certainly alpha is predominating in some parts of the province, gamma is, and delta will start predominating. And that will continue. Like in the future, there may be other variants of interest or variants of concern that may circulate. The important thing is, so far, all the vaccines protect well against the variants of concern. And the simple principles of testing, staying home if you're unwell, close contacts if they're unvaccinated, staying home, those principles still work. And I think that'll have to be our key tools as we move forward.
We'll take another question in the room. Mark?
Dr. Shahab, Premier Moe had mentioned you've worked long hours over the past year. What has this past year been like for you dealing with this pandemic here in the province?
Well, I think, the last few weeks, obviously for, myself, my colleagues, both in the health system, hospital system, public health, have been getting easier. And that's because of a reduction in case numbers. Some public health teams do have some challenges because, those who are working on the front lines, because we have more contacts now. And I would like to make a request that sometimes, I think everyone's fed up of COVID. But if you're named as a case or a contact, public health staff are doing their job when they call you. And, it's no one's fault if you get COVID or if you're a close contact. But, they're just trying to inform you and advise you that you need to isolate. I think that will continue, and we need to just keep that as part of our plans. And I think, as we go out and about, we may be going to small events, large events. If you're feeling unwell, stay home, because I think that's going to be key. Because we all remember 2019 and before, where colleagues would drag themselves to work if they're unwell, or you had that important wedding or a birthday party that you had to go to because it was special, and even if you're unwell, you went. That's what needs to be different this year. But otherwise, I think all of us are looking forward to some, downtime. I think some vacation time over the summer. It's been a great summer so far, and hopefully will continue to be. And I think all of us should, celebrate our success, take some time off, but I'll just like to close by saying that the higher our vaccine numbers continue to go, the better of a fall we hopefully will have. And I think that still needs to be a key thing for people who still haven't been vaccinated. And I know vaccine teams will continue to work hard throughout the summer, completing vaccinations, first dose, second dose. Unfortunately, acute care colleagues will continue to look after patients with COVID, but also continue with all the other needs that the health system has to meet. So I think work continues, but certainly I think we should take this opportunity 18 months into the pandemic to really celebrate our success and enjoy some downtime.
Follow up, Mark?
Yes, the Hatchet Lake Dene Nation has seen over 100 cases in the last week or so. Is the province planning any supports for that community to help them get through this outbreak?
We've been working quite hard in that community. Dr. Shahab, I just turn it over to you, but maybe Scott, you'd also mention a little bit on what we're doing in the community with respect to testing and engagement there as well. But Dr. Shahab?
Yeah, so I'll make a few comments in this call. But throughout the pandemic, the circumstances in the far north and north have been different in terms of some of the guidance was different, some of the settings are different. Even last year, the SHA went out of its way to provide surge support for testing and other matters. But again, our partners in the far north, again, have been, even though it's summer, many of us are taking some time off. When there's a cluster and outbreak, it's all hands on deck. It's a lot of work, finding all the contacts, supporting people to isolate, and that is continuing. And I'll maybe ask Scott to maybe advise further.
Thanks, Dr. Shahab. Just to outline some of the stuff that's going on at Hatchet Lake, we have offered assistance, obviously, to local First Nations health teams to support the outbreak response. Contact tracing, isolation of cases, and close contacts is well underway. We've also activated surge capacity, and additional staff have been mobilized from both NISA and Indigenous Services Canada. There's voluntary mass testing underway and active case finding. There's also a community door-to-door approach for vaccination, and NISA has, as I understand it, shipped more vaccines up north to accommodate that. Lots of support from local leaderships. Chief and council have announced that all community members need to cooperate and support actions of the public health and medical teams. I also know that the PA Grand Council Vice Chief has addressed the community directly and talked about measures. So there's lots of things going on. We're monitoring the situation, and we'll provide whatever support and resources that our partners at NISA and ICU need.
We'll take our next question on the line. Operator?
We have Murray Mandrick with the Leader Post.
Good afternoon, gentlemen. I'm curious why we're not seeing a more definitive, more aggressive plan to have that remaining 30% unvaccinated, vaccinated. You're now obviously not going to have the same carrot and stick availabilities as of Monday, and we're last in the nation in terms of unvaccinated people. And over the last couple of weeks, we've only seen roughly 1 or 2% of more people get vaccinated. Why aren't we seeing something, or do you have something, I guess, planned that's more aggressive in terms of addressing that 30% or so?
Maybe just make a couple comments, and Dr. Shahab and even Scott, if you want to speak a little bit to what we have been doing and will continue to do in the months ahead. First of all, the Saskatchewan statistics are off of our health card numbers, which is 1,225,000. There's not that many people that live in Saskatchewan. So if we use the Statistics Canada numbers of 1,180,000, there would be, you know, a 2 or 3% gain from where we are. That being said, where we are, 71% of people over 12 that have received their first shot continues to climb. You know, 1,000, 1,200 each and every day, and hasn't really broke over the course of the last number of months. And what we saw when we achieved the 40 and up 70 percentile benchmark that we had is we now see that that category, that age category, up over 80%, and I believe about 81% vaccinated now. The 30 and up ended up, today it's at 76%, went by the 70%, and the 18 and up is 72%, and we're seeing the 12 and up continue to climb about 1% every 7 or 8 days, and we would expect that to continue throughout the summer into the fall, which would put us into a fairly solid situation going into this fall. But we do strongly encourage everyone to continue to make the time and take the time to go out and ultimately get vaccinated for the first shot, and then ultimately their second shot. On the second dose strategy, we're seeing that actually climb about 1% or better each and every day. So a large number of second doses that are going out. And when you look at the data that Dr. Shahab has provided, the second dose is also very, very important to complete that vaccination cycle and ultimately give you the best chance of not having the severe outcomes at the very least from contracting COVID. So there are initiatives that are in place today. There's initiatives, and Scott will speak to those in a minute, and those initiatives will continue ultimately into the future. But the greatest initiative that we could encourage people to take is just to take the time to make the call, make an appointment, or visit a drive-through or a pharmacy and get their shot. It is, you know, we are in a good place here in Saskatchewan and Canada with our access to vaccines at the moment, and we would hope that everyone would ultimately consider that and keep themselves and those around them safe. Dr. Shahab, anything to add before Scott does?
Yeah, I think some general comments from my side. You know, absolutely, I think the uptake in people who are older, 60 and older, for example, exceeded expectations, exceeded any targets we had, and I think that's great. For younger age groups, we did expect a bit of a gradient with younger age groups because the risk perception may not be that high, and there may be other things coming in the way of getting vaccinated, you know, time and convenience and complacency. But having said that, I think we do need to understand, and we have to look at other parts of the world with high vaccine uptakes, now seeing a bit of a resurgence like in the UK, parts of the US, and we have to remember that, you know, it is a different playing field right now with the Alpha and the Delta variants, and they are more transmissible, in some cases more severe, you know, increased hospitalizations in all age groups, including young people. So that's really, I think, an additional impetus for those who may be sitting on the fence to choose to get vaccinated. We know that ultimately about 10% may choose never to get vaccinated, although again, I think I would really speak to those 10% who are vaccine hesitant and say, you know, do rethink this, because we all want, all of us, to be safe in the summer and throughout the fall, even if we were to see a bit of a surge. But certainly, I think that's from the provider side, and but I think you know, access and convenience issues. There's innovative things that are happening throughout the province, and whenever vaccine has come to young people or people who hadn't gone around to getting vaccinated, you know, everyone when that's happened has accepted the vaccine, and I think that's been of great satisfaction when vaccine is made available, that there's a high uptake even in pockets where previously there was a low vaccine uptake. And with that, maybe I'll ask Scott to maybe speak further on that.
So the only thing I would add, Murray, is, you know, we continue to vaccinate across the province. The immunization program isn't over because we've met the targets around step 1, step 2, step 3. We're not certainly seeing, you know, the high volumes of first doses come in, but at 1,500 to 2,000 a day over 8 weeks, that's another 90 to 100,000 residents getting first doses. We won't stop vaccinating. As the Premier has already said, and Dr. Shahab has shown with the data, the most definitive tool we've had in the entire pandemic is the vaccines, and we're sitting 7 months into the year, and we've vaccinated, you know, over 730,000 individual first doses, where our second doses continue to climb. I guess what I would say is we're going to continue to offer multiple clinics and work with our partners. There are 4 main groups involved in vaccination, as you know, the SHA, community pharmacies across this province, Indigenous Services Canada, and NIFA. And we will continue to work with all of those partners to bring vaccines to people that are still either hesitant or haven't had the opportunity to get vaccinated, and vaccine supply continues to meet our demand. And as more data comes out in the fall, hopefully, we'll be vaccinating our kids under the age of 12, so we'll see some surge, and we'll be prepared for that as well.
Follow-up, Murray?
I guess, can you offer the Saskatchewan public something to, and this is, I guess, more for Dr. Shahab and Mr. Livingstone, to express why we are in a good place? Because if we no longer have the carrot and stick with restrictions being lifted, if we are someplace close to 30% or 25% of unvaccinated, we do run a risk of the new variants being spread more quickly and having a greater impact. There's a pretty good argument out there that people see today's numbers and might not agree that we're necessarily in a good place except for second doses. So what is the argument right now that we are actually in a good place to be doing what we're doing right now in terms of reopening right now, considering where we are with vaccinations on first dose related to elsewhere and concerning the variant causes that you guys have outlined?
Yeah. So Murray, maybe I'll make some initial comments and maybe I'll start way back in March 2020. That at that time, we had no expectation of if and when a vaccine will be available. And we also knew at that time that we can't remain in lockdown forever. And at that time, we needed to prevent a surge that overwhelmed the health system, prevent surges that overwhelmed the health system. And we knew that we would have to open and close. We reopened over the summer, but then in the fall and in spring, we had to, tighten up and then reopen. And the prevailing wisdom was that we'll have to manage in terms of a slow burn or waves and troughs. But then, of course, December, January onwards changed everything for the most vulnerable, long-term care. We saw a dramatic impact of how safe and effective vaccines were for long-term care. And we can see that in many restrictions being lifted for visiting our loved ones in long-term care. But some cautions that, we still recommend you wear a mask. We still recommend you be fully vaccinated if you choose to visit your loved ones in long-term care. And that's what we are seeing right now. Some of that may change in the future. There may be a need for booster doses in the winter for long-term care residents. But right now, this is a good time if you are in long-term care and you are fully vaccinated, and if you as a loved one are fully vaccinated and want to visit. So that's one example. Secondly, once vaccinations picked up for the general population by age groups March onwards, we have seen declining hospitalization deaths in the fully vaccinated, and the data we showed in May and June confirms that. So I think people who are fully vaccinated are in a good place, and they can meet normally without masks, indoors or outdoors, with friends and family who are fully vaccinated. So this is a great time if you're fully vaccinated. If you're unvaccinated, the only protection you have is low case numbers due to the people who are fully vaccinated. The people who are fully vaccinated are providing some protection to you, but COVID is sneaky and finds its way out. The fact that we have 10, 20 pop-up cases due to no known exposure means that it will still transmit at a low level and continue to transmit for months or years. And if you're unvaccinated, you're actually in a worse place than last year, because now you don't have the Wuhan strain. You have variants like Alpha and Gamma and Delta that are more transmittable, can be more severe irrespective of age. So no, you are not in a good place if you're unvaccinated. And that risk will remain and continue to be there. And if there's a surge late summer or fall, your risk will be much higher than what your risk was last year.
We'll take our next question in the room. Lisa?
Looking at the guidelines kind of that were released today as of Sunday and going ahead, there wasn't a lot of specificity there. It seemed a lot like, everybody's going to decide for themselves what they want to do. Businesses are going to decide for themselves what they want to do. Was that the intent in putting that out? And is that wise given the threat that the Delta variant and other variants pose?
So I think this links to the earlier comment by question by Murray that at some time you have to move on, and you always find the best time. And in March, in April, some targets are proposed, step 1, 2, and 3. Those have been met. Can they be exceeded in terms of vaccine uptake? Absolutely. Are our numbers fairly low? Yes. Can they be lower? Yeah. I always said that if we go below 5 cases per 100,000, that's a safe zone. We are there now, but there are pockets where our case numbers are still high, and we understand the reasons for that. Our test positivity is under 5%. Again, we're in a good place, but again, there may be times when it may go up due to clusters or outbreaks. So at this point, obviously, it makes sense to reopen in a way that now that we have individuals who can choose that, okay, I'm fully vaccinated, I can choose to go into an environment which is indoors, where I can choose to wear a mask if I feel that it'll protect me because I may be older or may have health or other risk factors, or I can choose not to wear a mask because I feel well protected through my vaccination status. So it is a matter of individual choice. But again, I think this is what the recommendation is for now. And hopefully this is how it will remain in the summer and the fall. But if things were to change, there may be, as in some countries, there has been a stronger recommendation to again start wearing masks, especially if you're unvaccinated in crowded indoor settings. We aren't there at this point, but that may happen. But certainly, I think at this point, it is time to, especially for those who are fully vaccinated and want to have a more normal summer, more normal interactions with loved ones, or be able to work in an office environment or in a workplace in a more normal way. This is as safe as it's going to get, for the foreseeable future. And that is why we now have to live with COVID. It's not really practical to remain in lockdown forever. But again, I'd like to close by saying that still doesn't apply to people who choose to remain unvaccinated. Their risk remains the same or is higher. But again, I think at this point, everyone will have to make that determination, whether you're meeting with friends and family, that are you more comfortable interacting with people who are fully vaccinated or not, and similarly in other settings as well.
Follow-up, Lisa?
You alluded a little bit to it there, but some of the countries that were specifically noted when you did the reopening plan have put in more restrictions after reopening. Israel now has a mask mandate. They're looking at more restrictions. So is it possible that we're going to open, things will happen, we will get more actual public health orders? And at what point would that happen?
Yeah, so most recently I listened to the full press conference by the Prime Minister of the UK and his Chief Medical Officer and medical advisors. That was on Tuesday. And exactly they are in a specific situation where on the one hand, they are, slightly better than us in terms of first dose, second dose. I think 65% first dose, 50% second dose, if my memory serves me right. So slightly better in second doses, but almost the same as Saskatchewan. They are seeing a resurgence, but they're not really changing their reopening plans because their resurgence is mostly in young people, and they're seeing increase in hospitalizations, but not to an extent that it will overwhelm the health system. So they have always also said that, for people who are fully vaccinated, this is the opportunity to reopen and keep monitoring, and their mask recommendations are similar to ours. Same as in the US jurisdictions, where again, some states that have high vaccine uptake are doing well, some states that have low vaccine uptake, and especially in some states where there are counties with low vaccine uptake, now 2 or 3 months into their, after completing their final vaccination and plateauing, they are seeing a bit of a resurgence. And this is something we'll have to watch. And, we can't predict the future. We'll have to monitor it and advise accordingly. But, while I don't want to be too prescriptive at this time, I think broad public health measures, the same way that were applied last year, probably won't work as effectively because the 70%, at this time when the variants of concern are covered well by the vaccine, the 70% who are vaccinated, the 70% who are generally compliant will not be the ones who are transmitting. So the approach, if we were to see a resurgence, may have to be more specific for people who are unvaccinated at that time, and we do that all the time with pertussis, measles, mumps outbreaks. But we'll have to see what the transmission chains are, what the networks are, and whether it's a geographical community where you need to surge up in terms of testing and vaccinations, or whether it's a network of individuals who are connected by social reasons or work related. That it'll have to be managed on a case by case basis, which we already do for other vaccine preventable diseases. But I think if our numbers rise, specific measures may need to be taken. But we remain confident that the health system will be able to deal with hospitalizations. But just because the health system can deal with hospitalization really doesn't mean that those who are unvaccinated should choose to remain unvaccinated. I think with a safe and effective vaccine, and I've always said this, that the vast majority of countries are still waiting to vaccinate the healthcare workers and vaccinate people who are elder and at high risk. And what a privilege it is to have vaccines easily available. And in fact, vaccine teams now going out of the way so to accommodate people who can't find that 1 hour to make an appointment or go to an appointment.
Just on that, Lisa, as well, there is a difference already in a few cases where if you're vaccinated, you're being treated differently than if you're unvaccinated. One is if you're returning from the United States or another country, for example. If you have a test 2 days before, a test that is negative as you cross the border, you don't have to self-isolate for the 2 weeks as of July the 5th, as long as your travel is essential travel. The same goes for within the province. When you come in close contact with someone who has been COVID positive, and as Dr. Shahab said, our contact tracing team would reach out to you to self-isolate for a period of time. If you're fully vaccinated, that's a self-monitor requirement. And so there is some instances where already where if you have chosen not to be vaccinated, there are times when you will be asked to self-isolate for a longer period of time than if you were vaccinated. And so that spread is already there in certain aspects of society as we move forward.
We'll take our next question in the room. Adam?
In the guidance, it says that schools will return to pre-pandemic. Can you give us a sense of what that means? Does that mean classrooms can return to how they looked? Do you expect students to be in masks because they won't be vaccinated by the start of school? But what do you anticipate being the recommendation? Because I know the school divisions put that in place, not the province.
So I think, and maybe more appropriate for education, maybe to speak to it in August in terms of more detailed plans. But what I'd like to say is that if, for example, you have a setting where you have a high vaccine uptake in parents, and then you have a higher vaccine uptake in children 12 and older, and a higher vaccine uptake in school staff, I mean, that is the ideal situation for a normal start to school. Normal classroom environments, masks not required, but if some parents want their children to wear a mask, that's fine. If some staff want to wear a mask, that's fine, but not required. Normal extracurricular activities, because that shield of a highly vaccinated household environment and schools environment will protect unvaccinated children under 12. And we already know that it's unlikely that children under 12 will be offered vaccines till much later this year or early into the next year. But obviously, if there's increase in local transmission, in the community, and as part of public health assessment, where medical health officers will be working closely with school divisions, if the assessment is that there is a risk of importation of cases into classrooms happening, then at that time, further decisions can be made that may include, obviously, isolation of cases and close contacts. But again, even at that time, whether it's September, October, provision of vaccines in under-vaccinated populations will still be an option. But again, why run the risk of facing that? I mean, I think we still have a month and a half before school reopens. And this is a reminder for those parents who haven't gotten around to getting vaccinated. Do it for yourself. Do it to ensure that your children have a normal school year. And the same goes for school staff.
Follow up, Adam?
With the emergency order expiring on Sunday, what does the province have as far as mechanisms go? I know there's guidance being offered, but as I understand it, the isolation won't be mandatory anymore. Like public health can't fine someone for not isolating. Is that the case because the public health orders are being removed? And I guess what are the steps the government's going to take? You've obviously talked about it. If there is a need to implement orders in some of these areas where we see clusters, what can people expect?
Many of the public health orders that we had in place were under Dr. Shahab's signature, were actually not under the emergency order. And Scott had spoken to this a week or two ago with respect to the emergency order. I might ask him to just speak to it again, which had the largest impact of the emergency order was allow us to continue with an agreement that we had with our healthcare teams to ensure that they're working in one place, for example, and able to really run our vaccination program, our testing program. And I think Scott had mentioned we're very grateful for the agreement that we had with our healthcare unions across the province. But maybe you want to speak to the public health orders, which many were under the Chief Medical Health Officer's signature.
Yeah, so under the Public Health Act and the clinical disease guidelines, medical health officers can still require individuals isolate, but it really comes to that because, as we see with other vaccine-preventable diseases, most people are reasonable, if there's a measles case or a pertussis case, most individuals who, as cases or unvaccinated close contacts do isolate, and we hope and expect that will be the approach. But, if in future, again, if there was a variant to emerge that was not as well covered by the vaccine, and if we had to wait for additional boosters which were designed to impact that variant, at a future date, there's no ruling out going back to additional measures if required. But again, I think at this time, it is very much an approach that is aligned with living with COVID, managing COVID as an endemic illness, just like other vaccine-preventable clinical diseases, and also but realizing that it can become hyper-endemic. It can surge in small areas where it'll have to be managed like outbreaks of other vaccine-preventable diseases that we have managed in the past.
Scott, do you want to, repeat what you said a couple of weeks ago, or any comments on that, on the emergency order?
Sure. So with the emergency order being lifted, it really speaks to the ending eventually of our memorandum of understanding with our union partners, which really created a flexibility for the SHA to respond to COVID. Whether it was as Premier has already outlined, the cohorting of staff per single facility to minimize the likelihood of infection inter-facility and people bringing that in, but also the flexibility to use surge capacity within the system, broadcast to get staff to be assigned where we needed them, whether it was contact tracing lab or immunization. And the only other thing I would add is as the Premier said and Dr. Shahab has said, COVID doesn't end on July 12th, and the SHA has capacity and will maintain capacity to both monitor COVID across the province, respond with testing, contact tracing, and all those other aspects of response that we've been doing throughout the pandemic, including immunization. And we will continue to do that using a dimmer switch if we have to increase supports in certain areas of the province or because of outbreak management, we'll do so. If we can continue to wind down services because we're not seeing cases, we'll do that. We won't do that on a 2-week interval. We will maintain lots of capacity probably till the end of September, see where we are then, and through our weekly monitoring, make decisions on what type of services we'll have to provide on an ongoing basis.
We'll take our last question on the line, operator.
We have Roberta Bell with Global.
What advice would you have for daycare providers specifically who are dealing with lots of young children and toddlers and, they can't really control what's going on outside of, the daycare center with the different families and whatnot who might be concerned?
I'd just say, Dr. Shahab, you might have something to add, but that's precisely why we'd put out the release that we did today about, as we move forward, there are no public health measures officially that will be in place. The emergency order obviously is lifted, and what we put out today was just some high-level guidance with respect to how people can conduct themselves in their profession, in their personal lives, in their home lives, as they move forward. Obviously, sanitary would be very important, whether it's a daycare or your own home. Masking, if you choose to wear a mask to keep yourself safe in certain environments, you most certainly could do that. And your hand sanitation, I think, is something that will most certainly continue as we look ahead. But that is why we put out the very brief but concise guidance that we did here today, was so that people could look to, first of all, understand that the public health measures are not in place. However, in saying that, there are a number of things that I think they will choose to continue to do in places like a daycare, in places like a K-12 school, in places ultimately in our communities. But Dr. Shahab, a little more to add on that.
Yeah, I'd just like to again start by recognizing, essential workers and healthcare, but others, and also school and daycare staff, because even in last year in February, March, when schools closed in February, March, April, daycares kept going, and daycares kept going because essential workers, healthcare, grocery stores, trucking had to go to work, fire, police, ambulance. So that happened in an environment when there was no vaccination, and cases and contacts were followed up. And then we saw challenges with variants, that we saw outbreaks in daycares that were larger, affecting more children and staff, over March, April, especially in Regina. And again, daycares kept going, kept open, were very cooperative with public health and quickly managing outbreaks and contacting parents and so forth. And I think now, obviously, I would expect that and hope that all daycare staff are fully vaccinated. I hope all parents who need to send their children to daycare, who are too young to be vaccinated, are themselves vaccinated. I think the responsible thing to do if you're choosing to use a daycare is to be fully vaccinated yourself when you're sending your child to a daycare. And there is multiple layers of safety because of that. But again, I do want to recognize that, so many people who were working throughout the pandemic, when things were tough and when things were not so tough, just want to recognize that, and that includes daycare staff as well.
Follow-up, Roberta?
In just regards to the Delta variant becoming a more dominant strain here, we were seeing out of Israel, for example, a significant drop-off in the reported efficacy of the Pfizer vaccine. How closely are we watching that, and are we concerned?
Yeah, we are watching that very closely at a provincial level with our partners in other provinces, with the Public Health Agency, and with obviously with other countries. And there's several reasons for that. First of all, we already know, and our data shows that the 2 doses protect to a high degree from hospitalization and death. However, with the Delta variant, there may be a 15-20% risk of mild illness. And further to Scott's comments, that's especially important when you have immunocompromised, vulnerable people, like in a cancer clinic or an acute care facility, ICU, where the last thing you need is a COVID outbreak. Even though people are fully vaccinated, even a mild illness can, if people have other comorbidities, can cause some complications. But having said that, obviously, if we expect that 10 to 20% of people who are exposed to COVID, even if fully vaccinated, they may get a mild illness, but then they can transmit it, although at a lower rate, to people who may be immune compromised and not fully protected by vaccination. So all these things will be monitored. They will go into decision making. Obviously, many countries are thinking that, is there a time or a need to give a booster dose? If so, how long after the initial vaccine series? Is it 10 months? So already, that may happen in the late fall for people in long-term care who are vaccinated over January, February. So all those things will be monitored. Which vaccine product should be used as a booster? Will it be the same vaccine or a vaccine that's optimized for the variants in circulation? So that will be, again, a part of living with COVID, just like we have the flu vaccine, a new formulation every year. So will we likely have a COVID vaccine, a new formulation, which may be used as a booster, and still to be determined. I think there's good information that suggests that on the one hand, if you're young and healthy, 2 doses can protect you for more than a year. But if you're older or have other at-risk conditions, it may be a good idea to think of a booster at a year. So all those determinations are being made in Canada as well as in other countries, and we will learn from each other. And I would like to say that, as we enter into the fall, now that we're not doing all the things we were doing for the last 18 months to the same degree, we will see more coughs and colds. We will see more influenza. We didn't see any influenza last year. We'll probably see more outbreaks, unfortunately, due to influenza and long-term care than due to COVID. So again, make sure that you get your flu shot when it's available, September, October. All the principles that apply to COVID apply to coughs and colds. Don't visit your loved ones if you're unwell. Get tested. Stay home till you're better. Thank you.
Before we conclude today's update, I'll turn it over to Premier Moe for a final comment.
I would just say with that advice to not only go out and get your COVID shot, but when it's available, go out and get your flu shot for this coming year is a signal of a man that just never quits working and never quits looking ahead to what's coming at us. We were talking earlier about people that had worked throughout this pandemic and how valuable and how much we appreciate the effort that they made. And Dr. Shahab, you're one of them. That worked throughout this pandemic, worked quite a bit harder, actually, throughout the course of the last 17 years. And so just before we wrap up today, I was thinking back to a time likely last summer at some point when I said what I look forward to was a point in time when I would be able to shake your hand and say thank you for the effort that you had made. I think you quickly had said that, I think it was last March, that we likely wouldn't be able to shake hands until July of this next year. Well, July is here, and I'm 2.5 weeks past my second dose. I know you're further than that, past your second dose as well. So I was hoping I'd take the opportunity today to shake your hand and thank you properly for the effort that you have made on behalf of all Saskatchewan residents. Thank you very much. Very much appreciated. Thank you, everyone.
Thank you for joining us.
Thank you.
More of you show up when the doctor comes.